Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more mock questions, okay, from the previous year CPC examinations. If you are new to the channel, please support me by subscribing to the channel, and let's move on to the questions one by one. Let's discuss more and more guidelines, okay, from each question. Let's have a look into the questions one by one. Let's move to the first question. A 30-year-old female is having debridement performed on an infected ulcer with SR on the right foot. Using sharp dissection, the ulcer and SR infection was debrided all the way down to the bone of the foot. The bone had to be minimally trimmed because of a sharp point at the end of the metatarsal. After debriding the area, there was minimal bleeding because of very poor circulation of the foot. It seems that the toes next to the ulcer may have some involvement and cultures were taken. The area was dressed with sterile saline and dressings and then wrapped. What CPT code should be reported? So here we have to code only the procedure. Okay, and what procedure is being done? Debridement on an infected ulcer on the right foot. Okay, so the remaining is just the explaining how the procedure is being carried out. So let's move to the first CPT code 11000. What is 11000? 11000 represents debridement of extensive eczematous or infected skin up to 10% of body surface. Up to 10% debridement of extensive eczematous or infected skin. This is infected skin. But 10% of body surface it is mentioned. Okay. Here we have only for the foot. Now, what is the next CPT code? 11011. 11011 represents debridement. You should read from 11010. Okay. Debridement including removal of foreign material at the site of an open fracture and or open dislocation. Example, excisional debridement, skin, subcutaneous tissue, muscle fascia and muscle. 11011 represents debridement of the skin and subcutaneous tissue, muscle fascia. Let's move to the third option, third CPT code 11044. This is actually debridement of the bone, right? It's not muscle. What is mentioned in the question? See, using sharp, just go to the second sentence. Using sharp dissection, the ulcer and SR infection was debrided all the way down to the bone of the foot. Means until bone of the foot it is dissected. It's debrided. Okay, till bone. So muscle we cannot code 11011. 11011 we cannot code because it is muscle debridement. Moving on to say option C 11044. Debridement bone. Yes, this is a debridement bone, right? Includes epidermis, dermis, subcutaneous tissue, muscle and fascia if performed first 20 square centimeter or less. So this is bone, debridement of bone. Only we have to code. What is the last option, last CPT code? 15004. Just take 15004. What is 15004? It's surgical preparation or creation of recipient site by excision of open wounds, burn, SR or scare, or incisional release of scare, contracture, face, scalp, eyelids, mouth, neck, ears. 100 square centimeter or 1% of body surface area of infant and children. This is not infant and children. And also this is not the procedure. This is just mentioning surgical preparation like that. This is debridement directly. We got the exact code, right? Debridement of bone, which is code is option C 11044. Okay, so which represents debridement of bone. That is what we need, as mentioned in the first two sentences. Debridement performed on infected ulcer with SR on the right foot, and then using sharp dissection, see the infection was debrided all the way down to the bottom of bone of the foot. So bone debridement, which is in option only in one CPT code, that is 11044. So the correct answer is option C, CPT 11044. Okay. Now let's move to the second question. Patient was in the emergency room complaining of constipation with nausea and vomiting when taking Zovirax for his herpes zoster and Percocet for pain. His primary care physician came to the ER and admitted him to the hospital for intravenous therapy and management of this problem. His physician documented a detailed history, comprehensive examination, and a medical decision making of moderate complexity, which E&M service is reported. So here we have to code for the E&M service. Physician documented detailed history, comprehensive examination, and MDM is of moderate complexity. Okay. Go to first option, 99285. 99285, emergency department visit consists of 3 components: comprehensive history, comprehensive examination, and MDM is of high complexity. Now nothing is matching, right? So that's not the correct one. What is 99284? Again, emergency department visit, detailed history, detailed examination, MDM is of moderate complexity. Only one is matching. So that's also not the correct one. What is 99221? Actually here what procedure is being done? Patient was in the ER complaining of constipation and nausea and vomiting, but his physician, his PCP, primary care physician, came to the ER and admitted him to the hospital for IV therapy and management. Okay, so where is the procedure done? Actually, it's not in the ER. The procedure is being done in the hospital setup, not in the ER. Okay, so we have to code for hospital care, not for the emergency department. So don't confuse with what is mentioned in the question, because both are mentioned. Emergency department also mentioned in the question, because initially patient came in the emergency room, but nothing has been taken place in the emergency room, right? His physician directly admitted him to the hospital. So you have to code for the initial hospital care. So go to options C and D. These are the hospital care visit, initial hospital care E&M codes, 99221 and 99222. So from that you have to code. Okay. The other two are emergency department codes, which is not correct. So what is 99221? Detailed or comprehensive history, detailed or comprehensive examination, and MDM is of low complexity. So here detailed history, comprehensive examination. So two are there. Two components are matching. So you can code this one. Go to the other one also, 99222. It's comprehensive history, comprehensive examination, and MDM is of moderate complexity. Comprehensive history. Now we need detailed history, right? Comprehensive examination and MDM of moderate complexity. So here, and what is mentioned in the second, you should read if you get confused with these two codes, because see, in the first code, like option C, 99221, two components are matching, right? Two key components out of 3, 2 are matching. Detailed history, comprehensive examination are matching. Only MDM is mismatching, low complexity. But in option D, 99222, comprehensive history, no, here also 2 are matching. Comprehensive examination and MDM of moderate complexity, 2 are matching, right? But you have to identify from the question what exactly is happening or what procedure is being carried out. According to that, you have to read the paragraph in the after the code. In the CPT code book down, there is paragraph. There it is mentioned what exactly the procedure is being done. So 99221, below that, if you can see counseling and or coordination of care with other physician, other qualified healthcare professional or agencies are provided consistent with nature of problems and patients or family needs. Usually the problem requiring admission are of low severity. This is actually low severity because the physician is admitted him for IV therapy only. Okay. And typically 30 minutes are spent at the bedside and on the patient's hospital floor or unit. So here maximum 30 minutes is being spent. And what about in option D, 99222 code? 50 minutes. See, typically 50 minutes are spent at the bedside and on patient's hospital floor or unit. So here 50 minutes are spent. Even though the time is not mentioned in the question, how many minutes is being spent by the physician, you can identify it from the second sentence. His PCP came to the ER and admitted him to hospital for IV therapy and management of the problem. Okay. So, IV therapy, just here he has been admitted and then IV therapy has been started. Okay, IV therapy initially is from 30 minutes. And then physician documented. From that, the physician has documented detailed history, comprehensive examination and MDMS of moderate complexity. So, you cannot quote 50 minutes because 50 minutes is not spent for a simple IV therapy. You cannot code the other one, the 99222 code. Okay. So, since it's an initial visit, you have to code the first one, 99221, which is the correct answer. Option C, 99221. Detailed history, comprehensive examination and MDMS of moderate complexity. But like in the code, MDMS of low complexity. So, 2 key components with 30 minutes maximum spent. So, you should code 99221. Okay. Now, moving on to the third question. What is the correct way to code a patient having bradycardia due to demerol that was correctly prescribed and properly administered? Question seems simple. We just have to code ICD code. Actually, it's a simple question, okay? We just have to code the diagnosis, but understand what is there in the question. Patient is having bradycardia due to demerol. Demerol, it's a drug, it's an opioid, okay? That was correctly prescribed and properly administered. Means as per the physician side, everything was correct. Everything was correctly prescribed. Means there is no overdosing, there is no underdosing. It was correctly prescribed and it was properly administered. The drug was properly administered. But still, because of or due to that drug, the patient got bradycardia, which is a severe case, right? Bradycardia. So you have to code accordingly. First, we have to look for the T code. Let's identify which is the T code first. Okay. What is the first T code? T40.2x1a. What is T40.2x1a? T40.2x1a. Poisoning by other opioids, accidental. Initial encounter. Accidental or unintentional. Here it is not accidental or here it is not unintentional. It is directly prescribed by the physician. So this is not an unintentional or this is not an accidental poisoning. Okay, and also this is not poisoning. Okay, what is the next ICD T code? T40.25 2x5a. T40.2x5a. Adverse effect of other opioids initial encounter. Adverse effect. Okay, yes, this is an adverse effect, right? Because of using opioid. Because it is bradycardia, which is a severe case. And one more T code, T40.2x6a. 2x6a is underdosing of other opioids initial encounter. This is not underdosing also. That's why I told you initially. Question seems simple, but little confusing. You have to code the exact T code. Okay. Since this is not underdosing, not overdosing, not unintentional, not accidental, you have to code the adverse effect because as mentioned in the question, as mentioned in the documentation, it's clearly written there, clearly mentioned that the drug was correctly prescribed and properly administered. So it means it's an adverse effect of the drug, the side effect of the drug. Okay. So you have to code T40.2x5a. T40.2x5a is the correct T code, which is there in options A and C. Option A is not correct because 2x1a is there. So that is also not correct. So option C will be the answer, T40.2x5a. And what is the other R00.1? It represents bradycardia. Now the patient is in the hospital for bradycardia. So you have to code. So which code should come first? Of course, bradycardia, because patient having bradycardia due to demerol. Nothing about demerol is like there is no there is nothing negative mentioned in with related to demerol. Only because of demerol has been administered, that opioid has been administered, the patient was having bradycardia. So the what do you say? The patient is right now need treatment for bradycardia. So you have to code for the bradycardia first. Okay. So answer is option C. Code for bradycardia first, R00.1, and then followed by adverse effect. How this bradycardia occurred? Adverse effect of using the opioid, that is T40.2x5A. Okay. Now moving on to the fourth question. The physician inserted a ventriculoperitoneal shunt for the purpose of draining a cerebrospinal fluid shunt in a 10-year-old male patient with secondary hydrocephalus resulting from bacterial meningitis. Anesthesia was started at 11 a.m. The procedure was performed from 11:05 a.m. to 11:45 a.m. The patient was sent to recovery at 11:50 a.m. What CPT code is reported for the anesthesia and what anesthesia time is reported? So here in this question you have to code only for the anesthesia code and the time spent for anesthesia. Okay. I had mentioned earlier in the guidelines of anesthesia how to code anesthesia time. How to code anesthesia time? Anesthesia time should be calculated from the time the patient has been prepared for anesthesia until the patient is being sent to the recovery. That interval of time, that period of time is marked as anesthesia time, not the procedure ending time, till patient has been sent to recovery. So here what time anesthesia has started? Anesthesia has started, or else they will mention it as the patient was prepared for anesthesia at 11 a.m. Like that also you may get a question like that. Okay. So here anesthesia started at 11 a.m. So starting time is 11 a.m. and what time the patient is sent to recovery? 11:50 a.m. So 11 to 11:50, which means 50 minutes is anesthesia time. 50 minutes. Don't get confused because here it's mentioned the procedure was performed from 11:05 to 11:45. So from 11:05 to 11:45, 40 minutes. Don't think that 40 minutes is the correct one, or don't think that 45 minutes is the correct one. From anesthesia starting at 11 a.m. and procedure ends at 11:45. So don't think that anesthesia time is also 45 minutes. No. Anesthesia time should be until the recovery. The patient is sent to recovery. So 11:50. So 11 to 11:50, which is 50 minutes, is the anesthesia time. Okay. So 50 minutes is there in option C and D. What is CPT code option C? 00220. What procedure is being done here? Here, what anesthesia procedure is being done? Physician inserted a ventriculoperitoneal shunt for purpose of draining a CSF shunt for a male patient with secondary hydrocephalus resulting from bacterial meningitis. Okay, so what is 00220? 00220. Anesthesia for intracranial procedures, cerebrospinal fluid, shunting procedures. CSF represents a cerebrospinal fluid shunt, CSF shunt. Okay, this is what we need, draining a CSF shunt. What is 00215? Cranioplasty, anesthesia for cranioplasty or elevation of depressed skull fracture. No, that's not the correct one. So the correct answer is option C, 00220, anesthesia code for CSF shunt, and then anesthesia time 50 minutes. Okay. Let's move on to the fifth question. A 24-year-old patient had an abscess by her vulva which burst. She has developed a soft tissue infection caused by gas gangrene. The area was debrided of necrotic infected tissue. All of the pus was removed and irrigation was performed with a liter of saline until clear and clean. The infected area was completely drained and the wound was packed gently with sterile saline moistened gauze and pads were placed on top of this. The correct CPT code is. So here we have to code for the what is the procedure done here? Only CPT code they are asking. So what procedure is being done here? Debridement of vulva area, removal of pus. Let's go to CPT codes. Okay, one by one. What is the first option? 56405. Since this is a female genital related question, don't think that the answer will be, don't blindly think that female genital code which starts from 5, right? 50,000 series, 56, it's starting 56. So don't blindly think that without checking, don't mark answer as option A. It is not correct. Go to option A, 56405. That is incision and drainage of vulva or perineal abscess. IND of vulva and abscess. You have to check for the other codes also. What is 10061? Incision and drainage of abscess, carbuncle, suppurative hidradenitis, cutaneous or subcutaneous abscess, cyst furuncle, complicated or multiple. This is not multiple. What is 11004? Debridement of skin. This is debridement of skin, right? It is not IND. See, in the question it is mentioned there. The area was debrided. So it means this is debridement. This is not incision and drainage. So debridement code you have to code. That is a procedure carried out here. So 11004. Debridement of skin, subcutaneous tissue, muscle and fascia for necrotizing soft tissue infection, external genitalia and perineum. This is the area, external genitalia. Vulva is the external genitalia. So that is the answer. Option C, 11004. Just go to the C, option D also, 11042. What is 11042? Debridement subcutaneous tissue includes epidermis and dermis, first 20 square centimeter or less. Here it's nothing mentioned square centimeter or the area. The correct exact area is mentioned as vulva, which is external genitalia. So the correct answer is option C. Okay, 11004. Debridement of skin, subcutaneous tissue, external genitalia. Okay, this is how you need to find the answer. Don't blindly think that since female, the question is related to female genitalia, the answer should be from 5, 6. No, here the procedure carried out is debridement. So you have to code for debridement. If in the question it is instead of debridement, if it is mentioned as IND, incision and drainage carried out, then you can code for the genitalia, the 50,000 from 50,000 series. Okay. So anyway, here in this question, the correct answer is option C, 11004. So friends, these are few questions, more questions, few important questions from the CPC examination. If you find this video useful, please like and share. And if you are new to the channel, please support me by subscribing to the channel. If you have any queries, you can mark it in the comments. Okay. Thank you so much. Stay tuned for more videos. Bye. Take care.